Hi, good morning, everybody. We're doing a hybrid grand rounds today, in person and online. So thanks to people who are in person, thanks to people who are online. And we will hopefully entertain you and teach you a few things on this topic. So I'm Kara Lewis. I'm the Director of Education. So we know, everybody I think knows me from that respect. But I'm also involved in Make-A-Wish. I'm on the National Medical Advisory Board of Make-A-Wish, and I work with the Make-A-Wish Arizona, Chapter Medical Advisor of Make-A-Wish Arizona. And so I'm here with Kristen McElliot. I can introduce her a little bit too. Yes, she is from the Physical Medicine and Rehabilitation Division, and she is well known to a number of people here, but also she's also strongly involved in Make-A-Wish Arizona as a chapter medical advisor. And she's the one who kind of got me all excited about doing this talk today, to kind of make sure that everybody's aware of what's going on in some of the updates in Make-A-Wish eligibility and the role of a wish in pediatric neurosciences. So say whatever you want to say at that point.
I think you did a great job. So we can just go to the next slide because we've really kind of just said, oh, we're gonna use this one today. So,
and also that picture too, I do want to say that picture, going back to that, is also in honor of Dr. Kerrigan, who is retiring this week. He was my first child neurology attending when I was a medical student resident. So we go way, way back. So he's an icon of child neurologists.
Hopefully he's on here to the dedication. So yes, we did just list that we are part of Make-A-Wish Arizona. She's on our national board or representative in neurology. And then I am one of the chapter medical advisors here in Arizona. And then I'm also heading up kind of a WISH task force that we'll be talking about later today here at Children's. So just to kind of go through our quick couple eligibility objectives today. So we're going to talk a little bit about the history, the mission, and the eligibility framework for Arizona and international WISH eligibility.
And I sort of wanted to put a little thing on, kind of reminding all of us about why we're talking about this. You know, we know that improving the health of the child, you know, takes medical care, but it also takes emotional care, and adding in this hope and positive support we know improves recovery and outcomes. We've always sort of known that, but we're going to give some more data on that specific today. And on the third point about knowing the WISH eligible diagnoses within pediatric neurosciences, we all sort of know that in general, we think about cancer as the leading diagnosis for Make-A-Wish. But you know, neurosciences has a lot of these WISH eligible diagnoses, and we want to get the information out to you guys. Phoenix Children's is, as a icon says there, consistently named Best Children's Hospital by U.S. News and World Report, included in 2025 and 2026. 6 specialties, of course, including neurology and neurosurgery. But we want to be top in lots of ways, and this is another way we can do that too in terms of the Make-A-Wish part of it. So Kristen's going to tell you more of that.
Yeah, and then I'll touch about just kind of what we're doing here at Phoenix Children's, knowing some of the impacts internationally with Make-A-Wish and kind of what we can do here at Phoenix Children's. So I will start off with talking about, I didn't really know this when I first started Make-A-Wish, that Make-A-Wish started here in Phoenix. The first wish child was Chris. He was a 7-year-old boy with leukemia, and he was in love with the show in the 80s, Chips. So he really wanted to be a police officer. So he was able for his wish to be paraded around in the patrol car. He received a custom uniform. He got to be sworn in. I think he was even part of the motorcade. And because of the community support that went involved with the Phoenix PD, they were so inspired by this little boy and this experience that is actually how Make-A-Wish was born. So it's fully homegrown here in Phoenix. Some of the down and dirty numbers, Make-A-Wish Arizona has approximately been reaching about 450 wish children every year. Recently, last year in 2025, they were able to grant the history's top number of 476 children last year, and approximately 650,000 children worldwide. Last month, we actually got to celebrate Andres. He is a Phoenix Children's wish child, that he was Arizona's 9,000th wish. That was very exciting. He got to go to the World Cup. He was a cardiothoracic surgery patient here at Phoenix Children's. But Make-A-Wish is actually international. Some people really think this is just a homegrown. If you knew it was born here, maybe you didn't know that it reached all of the places in the globe. It's in all 50 states, 50 countries, and 6 continents. And then currently, I thought this was pretty exciting. On the most recent National Town Hall, Phoenix Children's was actually reported as the 5th leading hospital system for WISH referrals. And that was actually prior to some of our WISH dashboard stuff that has been going on. So I'll talk about that later in the slides. So there we go. So when I think about Phoenix Children's and our role with Make-A-Wish, it's really about one impact and one mission. You know, our mission statements might look different, but the language is really the same. It's about creating hope. It's about focusing on children and families and creating meaningful experiences for children in kind of their worst possible and hardest moments of their life. Together, we can create a lasting wish. And I also want to pause on what a wish is. You know, some people think it's just a nice moment. It's a nice gift. It's a nice experience in a moment in time. But we'll talk about that the significance of this moment is lasting. It's not short-lived. It's actually long-lasting. Children who have spent a large portion of their significant amount of time in the hospital, they undergo significant procedures, hospitalizations, living with a significant amount of medical uncertainty. A wish can give them that something that is really beyond their illness and beyond their diagnosis. Gives them something to look forward to, something to talk about, something that they can create positive memories with their entire family. And that's where I think this is relevant to us. As clinicians, we see a person, we don't need to be the person arranging the wish or knowing what the child needs or what the family truly needs, but we need to recognize the opportunity and make that connection. Because I think all of us will believe that hope and quality of life are part of pediatric healthcare. I think we all will guarantee that. Then connecting an eligible child with Make-A-Wish is another way we make impact for the whole child and the whole family. So I want to ask a question, and I want to think about it for a couple minutes, and I'll circle back on it later. But are we consistently identifying every child that could benefit from this opportunity? So these are some of the fun things to talk about is what is a wish? Some of our children really wish for what we all understand. Disney World, Disneyland, an experience with the ocean, going to the Bahamas, Hawaii, but there are many, many other things. John Cena here on the far right, he's probably the #1 wish celebrity. He's been granted over about 650 wishes with Wish Children. So celebrity meet and greets, they want to be, they want to have, they want to go, they want to meet, and they also want to give. A couple of the really significant wishes I've been a part of are, you know, a couple of children wanted to donate a sensory room to their school. One child was a football player after a head injury. He wanted to donate football helmets to his high school. We've had room makeovers. We've had campers for accessible travel. We've had adaptive equipment with bikes. And also the most kind of meaningful one I've been experienced with recently was a child suddenly died of SUDEP. And she was referred by myself for her epilepsy, and her family was offered a STAR dedication. So the mom, this was when I was still over at CRS, but mom came back to me and said, in the moments of darkness, the unbearable, her child's light was still shining. So that was very, very impactful. Just a little moment, and she was currently living in a homeless shelter. So that was something that I will always take with me. Another child that I recently had an experience with, their family knew that she was not going to be living very long, and they were able to get her a celebration of life party over at the Rain House. So there is a lot of creativity that go into these wishes, and they're very unique to each eligible child and family. So this is my biggest slide of the day here, is why should we be adding one more thing to our day, and why is this so important? So if we can agree that one wish is more than a fun event, the next question is, does it actually make a difference? The data really does support this. 98% of children and their families have reported that this wish experience they feel should be a opportunity for every child with a critical illness. Also on the right, when you look at the outcomes, it's not just about happiness. Yes, we see that listed at the top, joy and happiness, but we also see respite and distraction. Nearly 90% of children who had a wish reported that that's exactly what they had. It was particularly meaningful in pediatric health care because so much of our medically complex children's lives can be centered around what they cannot do. Their diagnosis, their limitations, their appointments, their procedures, and hospitalizations. A wish gives them a meaningful opportunity to step back. They get self-efficacy. 90% of children felt their wish experience brought them new knowledge, skills, and even confidence. That matters when a child is chronically or critically ill because they have little control over what happens to them. They don't get to choose when they get admitted. They don't get to choose what their next procedure is. And they don't get to pursue anything that is limiting them outside of the hospital. A wish gives them a voice in what they can do. It also talks about family bonding, inclusion, social engagement, and overall well-being. So when I look at this slide, I don't see a list of statistics. I see a theme that arises. A wish can help shift a child's experience from being defined by illness to being defined by possibility. And I think that's the clinical relevance for us today. We are very good at treating disease. We are really good at sometimes managing symptoms and preventing complications. But part of caring for children in serious illness is asking, how do we help this child experience joy, agency, connection, and hope while they're living through all of this? A wish is not a replacement for medical care, but it's a complement to it. So I love this video. So Dr. Patel in 2019 wanted to study wish impact over at Nationwide Children's. And I just wanted to share a couple moments of his emotional words. I cry every time.
My name is Anoop Patel. I am the section chief of neurology for Nationwide Children's. One of my greatest experiences in the WISH program was a young man, teenager named Deshaun. I remember reading his EEG or brainwave exam. That's one of the things I do. And I remember looking at that and I sat back and at the time he was being followed by one of my colleagues. And I said to her, I said, Dr. Jones, I said, this child is going to be sick. And he's going to get worse, and you need to be ready, and you need to prepare his family. I again wanted to give them a break from this illness. That's one of the great things that we see in the WISH kids is they get to kind of hit the pause button on whatever is making them sick, and again get to experience something with their family and give back. And so we did. We sent him on his trip, which was to meet his idol, Chris Paul, who at that time played for the LA Clippers. But the WISH program did something even better. They just totally took the experience and treated him and his family like VIPs. But then they also got to go to Universal Studios. He had some younger siblings who really liked amusement parks. And so, you know, they kept saying, Deshaun, you gave this to me. You let me do this. Thank you, thank you, thank you. You're such a great big brother. And you have to remember at that time, Deshaun couldn't be a big brother. And I'll try not to get too choked up, but he couldn't be their role model. He couldn't be their big brother. He was sick. And then he was able to do that. And it just changed him completely. But then he came back and I said, how's it going? How's your trip? And you know, he lit up and was so excited and shared these stories, brought a picture back that I framed. And he then said, well, I haven't had a seizure since I left, or, you know, for the trip. I said, excuse me? And I looked at his mom and I said, is that true? And she's like, couldn't wait to tell you. He had not had a seizure. That was over 3 years ago, and he has still had no seizures since then. And I kept thinking to myself, what is going on that you could give something this simple, but have such a great impact? You know, I thought it would be something in a short term where I could give them that pause button. They can enjoy their time with their family and take a break from their illness, but then everything would start back up. I wasn't seeing that. I thought, well, let's see if science can help explain what happens when you have a WISH experience. Perhaps there's something more that's long lasting in these kids and their families that we could collect. And what we did was we took a group of kids, we took all the WISH kids who got wishes here at Nationwide Children's Hospital in the last 5 years. And we tried to match those kids to similar kids that were like them. But the only really major difference was for whatever reason, they didn't get a wish. What we found was that the kids with wishes did, compared to those that didn't get wishes, had a lot less likelihood of going to the emergency department, getting hospitalized, utilizing healthcare research or resources, a lot less than those kids who didn't get the wish. And I found that to be amazing because it really highlighted what we saw in our experiences, but now crystallized it for the first time that showed there is a return on investment from a wish experience. That not only are you giving a child and their family hope, not only are you giving your child and family a break from their illness, not only are you giving a child and their family an opportunity to give back to their siblings and to their other loved ones, you're giving them an opportunity to save healthcare dollars. You're giving them an opportunity to not come back to the hospital, to spend time with their family where they belong when they're sick and have an illness. A wish is more than just a nice thing to do, that you are going to help their care. You're going to help them get better. And now I'm passionate to make sure that every kid out there gets a wish. I now have a mission. I have a goal that I've got to provide every eligible kid a wish. You can change a life for the rest of their life. You can improve the quality of their life. You can transform their healthcare by giving, by donating, by providing a resource that otherwise we wouldn't have. That's what you can do. You can do it today, you can do it tomorrow, but more importantly, you're going to change a life forever.
That video gets me every time. So I think we can all agree now that there's a lot of emotion that goes into the impact of what this can be. So if we know that children can benefit this, we need to make sure we're actually finding them.
So this is where it comes into medical eligibility criteria. And of course, everybody would love to say all of our children deserve a trip to Disneyland or something like that. So everybody needs joy and hope in their lives. And obviously we have limited resources in a lot of ways, but the resources that are available for Make-A-Wish are really designed for this group of people, and the people who provide this are ready for these wish kids. So we are not at a point where we are trying to tamp down. We need to make sure we use every resource that we have. So main eligibility dependent, but no matter of what field you're in, the overlying arch is that the wishes go to people who meet these specific criteria. So they have to be ages between 2.5 years old and younger than 18 at the time of referral. They have to not have previously received a wish from Make-A-Wish or a similar organization. And then the key is that they're diagnosed with a progressive, degenerative, or malignant condition that is life-threatening. And critical illness is defined as this condition that requires high-risk therapy to survive, results in technology dependence, causes extreme long-term complications, and carries a high risk of death if not under close medical supervision. And so there's a lot of examples, long-term tracheostomy, ventilation, ventilator kids who are undergoing chemotherapy and radiation, but also illnesses that are degenerative in nature that we see a lot in the neurosciences, Rett syndrome and Sanfilippo, and life-threatening epilepsy, moya conditions and things that have really a high risk of death and illness. And so we find these kids and we can kind of provide this for them. This is actually a wish kid. All the pictures we have are we have permission to show these pictures because these are the pictures that the families have provided for this. But this is a wish kid with a patient of Dr. Kerrigan's with a nervous system disorder, just the terms that they put on there. So wanted to go on a RV trip to California. That was very cool. So the eligibility is based on critical illness. And the key is that children don't have to be end of life. And I think that's sort of an idea that we only give wishes to people who are end of life or in hospice or near death. That's not the idea. But the idea is that they have a critical illness that is at risk for maybe not allowing them to live through childhood. And that's where we get to it. And we've learned that earlier referral matters. It allows better participation, anticipation, future-oriented thinking. It's got greater psychosocial impact, enhanced family engagement. We think about a lot of our children who we know have a condition which will get worse, which will degenerate. And in a number of years, they may be non-ambulatory, nonverbal, and not able to do that. So earlier referral matters, getting it when they can enjoy it, appreciate it, and their families get all these benefits from it. It can be huge. We have a few big improvements. So every few years they go through and they change some of these qualifying conditions. And we have these things called these RGSs, which are the referral guidance sheets. And these have all these up here for different specialties. And so this is neurosciences. I'm only putting up the neurology neurosciences one right now, but they have one for every specialty. And sometimes when you're looking at kids, you may have to look at different sheets because they may have a neurological disorder, but they also have a cardiac issue or a pulmonary issue or something else like that. But specifically, there's some of these changes. And so this is the updates as of July 2026. And a lot of these conditions are on here. And these are the conditions that we would call sort of kind of automatic qualifiers or things that we know do it. Doesn't mean that anything that's not on here can't qualify. If you have reasons for why somebody is in a situation where they would qualify, of course, you talk to somebody and get it in there. But it's also nice to know things that are just automatic. So things like Helper's disease, Batten disease has always been on there, but we added the term neuronal ceroid lipofuscinosis, so that's a term that people know a little bit more. Congenital neuromuscular disease, that's been on there a long time. Those things like myotonic muscular dystrophy, Duchenne muscular dystrophy has been on there. We did add specifically and call out Dravet syndrome this year in July 2026. It's being called out as kind of a qualifying epilepsy condition that has a high mortality rate in childhood, very high risk of sudden unexpected death in epileptic persons due to these status epilepticus emergencies. So that's been kind of called out a little bit. And then there's also all the other epilepsy guidelines. We've kind of streamlined those a little bit because it's always hard to know. All children with epilepsy could be at risk, of course, for anything, but we're trying to find the ones who are really at high risk. We have a lot of them, right? So the ones specifically are the ones who are having convulsive seizures on a consistent basis over a year, every month, multiple times, or maybe they're not convulsive seizures, but they're the kind where they are, their heart rates are dropping, they're becoming asystolic consistently over the number of months, or they're coming into the hospital for status epilepticus. So we're trying to make these criteria very clear and cut and easy for people to know. Other things on the right, you're right. Huntington's disease, Leigh syndrome, these are ones that have been on there for a while. We do now have specifically called out multiple sclerosis. And these are specifically ones that have, the brain or spinal cord involvement with ongoing significant complications requiring these interventions. So not just a dot, but the actual condition. But I'm glad it's on there because now people think about this. It's one that people hadn't thought about before. Neurodegenerative disorders have been on there for a while. Tuberous sclerosis has always been on there, but we kind of added the terminology involving the brain or spinal cord that it's symptomatic. But again, it's not just a dot in there, but something that is actually causing issues. And so a lot of these things are just trying to kind of align with some of the other fields. So why does it really matter to you and your patients? And I think that this sort of a neurological disease carries one of the highest chronic psychosocial burdens in pediatrics. And that's because of medical complexity, but also this chronic medical trauma. These are patients who are here all the time. They're functional impairment. They're having to come and see people in various fields. They might be in wheelchairs. They're not able to get around the way they would expect. The caregiver burden is huge. Recurrent hospitalizations, we see these children all the time. And the uncertainty, especially in neurosciences. And these are, people say, what's the plan? And I don't know. What's the trajectory? We're not really sure. And so I love this line that Kristen kind of wrote, the idea that we're trying to give family-centered pediatric neuroscience care, but these hope-centered interventions, they align directly. So that's what we're trying to put it all together. So we know there's literature kind of out there, and we're getting this data out there to show that WISH is a really good medicine. And so I'm going to kind of give you guys a couple of the studies out there. The idea that, these are showing us definite benefits. These actual randomized controlled trials that we've done for this, which is we're all scientists, and this is how we like to get data. Kind of look at it as either randomized controlled trials or retrospective case control trials. So this was one of the ones that was from 2016, which was looking at the effects of the Make-A-Wish intervention on psychiatric symptoms and health-related quality of life in children with cancer. And this is with Dr. Anat Shoshani, who is a PhD psychologist at Tel Aviv University, and they were looking at sort of clinical trial, looking at children ages 5 to 12, and they had 66 kids who were newly diagnosed with a life-threatening cancer. And they were randomized into an intervention group who got a wish right away, and those who were sort of put on a wait list to go through these things. And they did this really to look at the effects of wish fulfillment on those children with cancer, and looking at what the intervention does, not just the experience or the event itself. And they had their little caveat that anybody who needed a rush wish just got that. They didn't get, randomized. And there's always a wait list to get a wish anyway. So this is a reasonable thing to kind of utilize that idea. There's always a wait list to be able to separate out those who get it and those who have to go through the typical wish. Everybody eventually got a wish, right? But I like their wish on here. It's just an interesting phrase that I like in the article about wishes and how, throughout history, we've kind of thought about wishes and there's sort of value attached to the act of making a wish, the idea of blowing out your candles and making a wish and, wishing on a shooting star and things like that, or the coins in the fountain. But there's not a lot of data about what that does. And I think the description is that a wish is different than a goal. We're all kind of goal oriented. You have a goal that you want to be free of seizures. You have a goal that you might want to walk again. You want to be free of this cancer. But that's your goal. But the wish is sort of different. It's coveted and it has more of a way of having a sense of agency about it. This is a child who can do something. Again, as Kristen said, they don't have any agency with when they get hospitalized or when they have, an event. But this is saying, what do you want? What do you really want? What do you get to do? How do you go through that? Getting that sense of agency. And then seeing it come through, it does things for these kids. They created it, they saw it, it happened, and then they have us. And so this study looked at this in the control group, which were the kids that had to wait for their wish versus the kids who got it. The control group showed lower levels of positive emotions over time. And they also didn't have any change in their levels of hope, health-related quality of life, psychological symptomatology. They were looking at this whole GSI, which is the Global Severity Index, which looks at overall distress and kind of calculates somatization, depression, anxiety, and panic. So they really went through all these things, separating these two groups. And so we just know, based on data and what we have, that wishes are good medicine. And these are more pictures we have. This is another children's patient. This is a patient of Dr. Chow Ha's, if she's listening, right? So a child with a nervous system disorder who wanted to go and take their family and do this amazing trip. So this is another study. This is a study you already heard about for Dr. Patel, sort of this retrospective case control analysis comparing patients who received or did not receive a wish, and then this associated impact on healthcare utilization. And that was kind of the interesting part. And costs over 2 years. That includes visits to primary, urgent, emergent care, and planned and unplanned inpatient hospitalizations. And they looked at sort of this wish savings benefit as a decline in the cost of care from years 1 to 2. And it exceeded the average cost of the wish. The average cost of the wish at that time was, $10,000, $10,100. But the cost savings of that is amazingly exceeding the cost of that. Just pure looking at money. But they looked at 496 patients who had received a wish and then matched them to age-based controls or controls based on age, gender, disease category, and disease complexity. And they found that these wish recipients were 2.5 times, huge number, right? More likely to have fewer unplanned admissions and 1.9% more likely to have fewer ED visits. This is another cooler slide of the same thing, right? So they had fewer unplanned hospital admissions, fewer unplanned ED visits. They had, 2.2 to 2.3 fold greater odds likelihood of the wish achieving that savings benefit compared to hospital charges, right? Interesting. And so, Kristen and I were talking about this. What is this? Why? Why is this happening? Why is this making a difference? Is it toxic stress physiology? Discuss among yourselves. Resilience? Is it adherence to care plans? Are they now willing to do this or wanting to do it more? Are they able to cope better? They can handle it better. Emotional regulation is helping a lot. Family engagement. Their families are doing all these things. So there's all these reasons for why this could be helping. The idea that this hope-centered intervention is influencing the medical interventions indirectly through that psychosocial stabilization, right? We like all this part a lot. This was the last study that I'll mention before we get into the new fun stuff. But this is a study, a large-scale international survey of children and their parents across 24 countries. So this is International Make-A-Wish. And they're looking at children and their parents who received a wish granting intervention in the preceding 5 years. And they had a total of 535 children. They had a total of 1,062 parents. And they're looking at primary outcomes of positive emotions experienced by the children and their parents during and after the intervention. And they looked at short-term and long-term. So some of these are really looking at long-term things. They also were looking at secondary outcomes like negative emotions in the children, sadness, disappointment, frustration. And those numbers were low. Like once they were getting their wishes, those numbers got lower on that, which was nice. And they really found that the wish granting interventions showed benefits in both the children and the parents. And that's kind of nice. We're trying to do this whole family-centered care. sustained positive emotions, short-term and long-term, improved family coping. And then the numbers that Kristen already said, 96.8% of the children, 95.4% of the kids said this wish is strongly agree this is critically important for children with a critical illness, that they're all saying this helped them and everybody needs to get this. So we're going to move on to sort of now what can we do about it next?
Yeah, so this is the stuff that I get excited about is we can all acknowledge this is all great, that we know the impact, we've got the literature to back it up, but what can we personally do? So at Phoenix Children's, we are now having a couple things that has been enrolled and it's been going at lightning speed. Just a little bit of background, I was over at CRS, Children's Rehabilitative Services, and we several years ago was able to implement utilizing the medical-based EHR to essentially pre-screen children utilizing their ICD-10 code. With the death of CRS, that system all went away. So I was able last summer, before I was onboarded here in August, to start sending off emails like rapid fire of how could I not lose that traction and bring this to the entire PCH system. So because of this, there has been systemically kind of a under recognition of eligibility. I mean, everybody I talk to does have a little bit of need for a little bit of provider education on what is truly eligible. And that's why the RDSs or that referral guidance sheets are so important. So part of that is the ground rounds today. So I'm happy that you have logged in or you're here in the room. We're also going to be pending some executive leadership to present to the division chief meetings for more engagement. And then the biggest thing that we've done is we've actually created a WISH dashboard. So that's been really, really impactful with the expertise and genius mind of Vinay Vidya and Karen Yeager with the medical informatics team. And then we're also building a WISH champion program. So building the WISH champion program, that's me and Fran. Fran's the CEO of Make-A-Wish Arizona. We're trying to gain support from everybody, physicians, APPs, nurses, medical assistants, social workers, child life specialists, and rehab therapists that are willing to own and kind of empower their division to own a subset of that dashboard. The 9 eligible divisions are complex care / palliative, allergy and immunology, cardiothoracic surgery and cardiology, endocrine, genetics, our neurosciences division, nephrology, hematology, oncology, and rheumatology. And what our champions will be doing is, like I said, owning a subset of that division dashboard, doing some family outreach, obtaining consent, and initiating those referrals as a team. This is where I get excited. I'm not a IT person, so this has been really fun and enlightening on how to build, but we're going from a passive referral system to systemic identification. So Make-A-Wish has always largely relied on passive referrals. Think about what that entails. That entails a clinician to recognize that child is eligible, understand the eligible criteria, and initiate that conversation. On the surface, that seems pretty reasonable, but think about the impact of our day. That is one added layer. So ultimately, I asked a question earlier, are we consistently identifying these children and acting upon this? This dashboard will then enable us to do just that. Wishes previously relied on who you happened to see, what clinic you were going to be in, whether someone happened to recognize the opportunity or even take value in the opportunity. So this has kind of started a quality initiative program that I have enrolled here at Phoenix Children's, that what if we didn't rely on just simple passive abilities for referrals? If we built a team, if we had a system, how are we able to now identify those children? So we are still using ICD-10 coding logic, utilizing ICD-10 codes. We've also added filters for inclusion and exclusion criteria. And then ultimately, this dashboard does not decide that a child is eligible or that they end up getting a wish, but it does identify who may be eligible. And then we have a shorter list to review. There's still a human being on the other end of this process who is going to be reviewing the chart and sending the information to the family. So we're not replacing clinical judgment. We're utilizing our tools to find the right children. And this is really a big equity piece for me. When we rely on exclusive passive referrals, we're going to have opportunities for missing children. The children maybe whose family are always here, they're more familiar with the healthcare system, they're English speaking, they're highly visible with their diagnosis, or cared for by clinicians. I think we have a high rate of sending our children to for wish experiences. So we're not going to rely on that because there is more systematic identification. So ultimately, that's what this project is about. It's not just getting wishes for more wishes, but we want to ensure the eligibility is not a chance. What determines a family is getting the opportunity is right there in front of us. This dashboard will give us a way to find children, track what happens after we identify them, and hopefully in the future study more impacts of this in closing all gaps. And because we really rely on communication between team partners, we now also have a Quip note documentation you might be seeing in some of the notes here. It is under Make-A-Wish referral. So we can track step by step, you know, who's eligible, who's not eligible. There is reciprocity back to the dashboard. And then ultimately we can see who we talk to. We can also track, you know, are they ready for a referral? Some of our children are not quite ready. You know, maybe they have Rett syndrome, but they're only 3. You know, they want to wait. So we can track that and then come back to those families when they're ready. Because I can guarantee if I said, Ray, I have 37 patients, go. I would lose a lot of people. It takes a team to work through all of this. So we now have the standardized communication tool. We're also going to be utilizing a little bit of the AI chart prep within Smart Chart. So we were able to review up to 30 documents. Again, this is not relying on AI to determine eligibility. It's helping us track those eligibility criteria. When are they hospitalized? What are their medications? What are their recent surgeries? It's making the WISH review easier for the clinician as well as the other opportunities for our partners to be reviewing and then documenting that eligibility criteria. And then we have another wish.
Yes.
Wishes are still good medicine.
Yeah, the wishes are still good medicine. Yeah, so these are all in these families that have you know, graciously shown their pictures and kind of shared this one. This is a patient of Dr. Burns. He's listed as well. So this is a child who had a wish to be a zookeeper at the San Diego Zoo, and we can have maybe a video later if we have time for that too. But you know, again, getting to take their family as well as an older sibling, and he was a previous wish kid. Who's been a previous wish kid, so they're going to do these things. So amazing things we'll see.
Okay, so Make-A-Wish has also done an incredible job with a team of epidemiologists. So prevalence and incidence studies are currently ongoing with per division, per state, and also per diagnosis to kind of project how many WISH eligible kids there will be. So currently there's a projected incidence of about 579 children. Currently, the chapter this last year had a fiscal year goal of 432, and we're almost there. I think I've got like 8-9 more to send at the end of the month. But we have a couple other updates to this slide, but we're, I think, about 428 of this current period currently. But what I love to see is that we just started creating this dashboard, and I pretty much am the sole user at this point. We do also have another really very interested nurse in nephrology, and she's also utilizing it as well. And we are now up 18.5% in regards to our over-year referrals over previous last year, and we just started utilizing it in May.
It had been 6.
It had been
already 2. Yes, it's all her.
And then this is the
So then this is specifically the incidence and prevalence study, you know, in our area, in our field, in neurology. The idea that there are probably 56, you know, patients out there who are right now eligible, meaning they're in the right age range, they've not received a wish before, they meet these criteria, they have this thing, and we have gotten 41 of them. So we're getting closer, right? And we have a sort of a qualified growth over prior of 2.5% or something like that. But again, finding these patients. So for example, what I had already said is that we're now kind of calling out Dravet syndrome. And I have to give a lot of kudos to my epileptologist in the room and also online. But I've sort of gone to a lot of our people and said, we have this diagnosis. We have lists of them. We've always had a dashboard here that sort of kept track of things. And Dr. Wilfong has told me we have a dashboard that keeps track of the kids with Dravet. Ours is a little bit different because they're only in that age range of 2.5 to 18. And then if they haven't had a wish, but everybody has said, if we find somebody, do you mind if we reach out to the family? And everybody has said, yes, please, they would like that. So that's something that is very generally willing to have us do part of the work. And so Kristen and I have been reaching out to them. So we have 5 more wishes that have been sort of put in because they have Dravet, because we found them, because we've reached out to them, and they're in there. I know I'm just got approved. So we're on the way for that. So again, we're one of the referral sites, but these are patients that may just have been kind of not recognized for that, and getting that equity that these patients who are eligible is a fabulous thing.
And I think one comment is when we've done reaching out, families who lived in this chronic level of stress, I had a mom be like, I didn't even realize that my experience with my child was worthy of a wish. She kind of thought, okay, my kid is not dying of cancer. My kid does not have a brain tumor. That's not relevant to me. So she called me. I actually called her, and she's like, thank you so much, because this is going to really, it was very sweet. She's like, thank you for making my kids' wishes come true. I said, that's not me, that's going to be them. But at least we have started the outreach, and that comes back to that generational influence that John Niggins talks about. Is it's a moment in time, and it does not take a significant extra effort on our part to familiarize ourselves with the eligibility criteria. So we've got one last video. Do you want to do Jane or Christopher? This one. Okay.
Christopher is like a ray of sunshine when he comes into a room. It doesn't matter what the day ahead holds. He wakes up and starts it fresh and just excited for what's to come.
I would say Christopher is one of the most determined kids that I have ever seen.
So right now I am strapping up the straps to keep this on me.
So Christopher was diagnosed with spinal muscular atrophy, or SMA, when he was 20 months old. He developed like a typical kid until he was a year old and not walking, 15 months and not walking, 18 months and still not walking. And so at that point, he started physical therapy. And after about a month in physical therapy, his physical therapist noticed that he was actually getting weaker instead of gaining strength. Christopher receives 2 treatments for the SMA. One is a monthly infusion, which helps his muscles to grow stronger. The other is a lumbar puncture. So he's given the medicine in his spine every 4 months. He also goes to physical therapy twice a week to work and build strength.
My favorite part is when I'm hooked up to my medicine and I can just go to the playroom and play and make slime and do a lot of crafts. Sometimes I do get frustrated though, like when I want to help carry stuff or run and play with my friends. I can play with my friends, but not like tag or other stuff my friends might do.
We knew about Make-A-Wish. I think for a long time, the thought was that only kids with terminally ill diseases or things going on could get their wishes granted.
I did have a bit of an idea. We looked at some things with my mom that I would like to do, like snorkeling or the dolphins. Oh, and swimming.
I was excited for him. I knew what he wanted to do. Part of the reason he made that particular wish is because being in the water for him is sort of an equalizer with other people. When he's able to float.
When he found out that there's such a thing as a Disney cruise, which combines Disneyland and oceans, I mean, that was just a given for him.
I was like really excited to do all of this stuff on the Disney cruise. I like swimming in the pools. Well, Daddy and Chris were on the Alka Mouse. I think the snorkeling, it was really fun. I got to see live stingray and coral reefs.
Seeing him get excited for like the character meet and greets or the water slide that was on the ship. I mean, it was just so fun. And he really just soaked it in. Yeah.
So in this picture, the dolphin is kissing me on the cheek, which was really cool. I never knew dolphins could actually do that. I had the best time ever.
When you're the parent of someone who's affected by a disease or something rare, you're always trying to find ways to support them and make their situation better. And sometimes there are things you just can't do. So I guess what I'm really thankful for with Make-A-Wish is the fact that they give us sort of the ability to provide those experiences for our kids that we wouldn't be able to do otherwise. My wish for Christopher is that he gets to be as like everyone else as he possibly can be.
We really want him to have as much independence as he can have. And we want him to be able to not give up and continue to want more for himself.
Don't give up. Never give up. There's always some way to do it.
Christopher is like a
Okay, so the main thing is trying to kind of make sure we have our best practices and sort of thinking about the children in your care and considering if they could be ineligible for WISH. So just sort of having that as a possibility. And again, some of the work that Kristen's doing and trying to make it easier for you to take that off your plate, that you don't have to necessarily be always thinking about it. We maybe come into you and say, hey, this patient, right? But if you're interested, you know, there's websites that are very, very easy, and we can reach out to people to kind of get to this. So there's the website that has it for the physicians and the providers who want to do this is wish.org. And then you can always reach out to all the WISH champions. We're going to try to get this out there more. That all the divisions are going to have their WISH champions for that. This also is a patient of the good Dr. Chapman who went to Disneyland just last month. So just so exciting, and send us the pictures and all these things. So sharing that part. And I would say too that it's been nice to see some of these changes happening. And I think that, you know, again, I give a lot of kudos to Kristen, but I also give a lot of kudos to the institution, and John Dickens has really kind of taken it on to make Make-A-Wish a priority here. We had Wish Day was here, Mackenzie over here as well from Make-A-Wish Arizona, and we had a event here on World Wish Day in April. So just some of this in our photos taken there with, you know, hopefully people who are on the Zoom as well, Dr. Abbott, Dr. Little, and Dr. Williams. So obviously if you have questions with any of this, you're going to reach out to people in your sections, in your divisions. We're going to try to make it as easy as possible, but just the goal is to try to make you aware of sort of the benefits of this, and maybe doing it a little sooner rather than later, and trying to know that it's not a huge, big issue. It's pretty fast to do. Some of the things that can be done, you know, just from a practical standpoint, once you figure out who they are, somebody else can reach out to them. You just mention it to them, and then somebody else can do a lot of that. The providers have to do sort of a diagnosis verification. You have to say, yes, this patient really has that. Okay, think about scams, occasional scams out in the world, right? We hear all this stuff, right? But so we're going to make sure that this is a patient who really does have this diagnosis, who really does have this wish, and we want to make sure they do that part of it. But we don't have to figure out what they want. We don't have to put any idea in their head. All that goes to the amazing WISH team that does all this work there to figure out what their sort of needs are and wishes are, and magical, coveted goals are. So, so I guess that is kind of most of what we have here at this point. We have time for questions. We also have a little swag here in the room. And we have Mackenzie here from Make-A-Wish Arizona with some of the information there. Becca's also one who often has helped us out a lot. Oh, I said the only reason she was allowed to not be here is that she's at Disneyland right now doing research. So that's fair enough.
Yeah, so Becca will be having some occasional office hours here too over in the Emily Center. That started, I think, 1 or 2 months ago. I think it's happened a couple of times that if you can't get a hold of Kara or myself, or you just have another opportunity to go or reach out with the Make-A-Wish medical outreach coordinator, who Mackenzie is here in her place. She's from the Wish Discovery team. So I don't know if there is any questions. I hope we did a good job of explaining kind of why this is so important. There's a lot of exciting things happening. That's really all.
Good job. Thank you. Excellent job of the inclusion criteria. Are there exclusion criteria?
Yes.
Okay, so yeah, the question is inclusion criteria and exclusion criteria. So the exclusion criteria really is, have they gotten a wish before, right? And when we had that, we reached out to one family and they said, oh, I got a wish 4 years ago. And that was also interesting to me when they told me that, because there's nowhere that says that. So we're also trying to capture that. This patient has gotten a wish. And then when we see them, we say, oh, you got your wish. Often as providers, we may not get that feedback back. So this idea that there can be a note in there, there can be a quip in there, there's an understanding that we've reached out, they're not interested, they want to refer it, they've already had one, all these things. So have they gotten a wish as an exclusion? Do they not meet the eligibility? Are they out of the age range? But otherwise, if they meet the eligibility, there's not a lot of things that keep them out of it. We try to make sure that it's open to otherwise everybody.
And I think some of the common questions are like, what if the child's in foster care? What about their immigration status? That does not play in any wish factor. It's based on the critical eligibility of that child, not the social situation.
Uncontrolled seizures is a relative issue depending on what their wish is and the nature of their seizures, I guess.
Yeah, I mean, and that's a lot of what I do on the National Medical Advisory Committee, is not deciding who gets wishes, but once they get a wish, what can it be? You know, there may be people that maybe don't want them swimming with the dolphins, right? And then there's a whole thing, I don't know if we had it on here, sort of safety to fly. Is this child safe to fly? And so, yeah, we have it with some flyers on that there, because true, there's a lot of patients that, yes, they have a seizure, they may have the rescue medicine, we're able to do that. But patients who, you know, once a month they go into status and their rescue medicines don't work, we don't want them on a plane to Hawaii. And we don't want them to land in Hawaii and then have their resources completely decimated with that, right? So the good news is we don't have to think about that when we're finding kids with wishes. We just say they're eligible for wish. And then the wish team is going to make that decision. All children have a couple different options that they do. And we do sort of make sure that everybody's encouraged to, if they have a travel wish, great. What's your non-travel wish? Like, what's your backup plan? And make sure that they're both there, because it may be that they are on a ventilator, they're on too much oxygen, they've had all these different devices in them, and we can't put them on planes. The planes are, you know, regular planes. They're not lay down flat seats kind of thing, right? So can they sit in a chair the whole time? So they always have a backup plan for that. So yeah, we don't have to necessarily decide that about, are they too sick to go on a wish? That's not our job to do. We just figure out, are they eligible for wish? And then they'll figure out what their wishes can be. Does that answer that part of it?
And I think sometimes people also think of certain children, you know, I see this a lot in my population in PM&R, is they have differences in the way they communicate with the world. They might be nonverbal. They might use an AAC device. They might not have the same functional relationship with their environment. And so people think, oh, they're not able to articulate the wish, so they're not eligible. And that's really not true. We've done a lot of really creative wishes for children that don't know how to articulate. They do a very good job of trying to work with the patients and the families, of maybe using some augmented communication device to get out what the child would be impactful, but also the parent report too as well. And I think that's where some of these at-home wishes are really meaningful for some of our neurodevelopmentally involved children, because the wish is not a travel wish. It's not a one-time experience, but it's a lasting wish. You know, it's that room that's making it more accessible. It's the adaptive equipment that's not approved by their insurance. It's the bedroom makeover. It's, you know, sometimes it's remodels, it's backyard equipment, you know, things that the child continually gets to experience, not just a one-time wish too as well. There's a lot of options.
Some of these equipment, we had kids who are wheelchair bound, potentially, they want to go to the beach. how many wheelchairs are beach accessible?
Yeah.
There's not ones that are paid for by your insurance, right? So getting them something that they can now go on the dunes is just kind of an amazing thing. That's a life altering gift.
So we've had, above ground pools for aquatic therapies. We've done campers to make a little bit of travel accessible for families. It's been really fun. Like it's fun to hear the creative things that people come up with. You heard the pickle story. There was one child that wanted to be a pickle worker.
Yes, I did. Yes, I did.
So he got to go to a pickle factory.
That was his life switch.
Well, he could only tolerate, because of the chemo,
Right.
he could only tolerate the taste of pickles. So it's, again, very creative. So lots of very unique, impactful wishes that carry meaning for these families.
How do you interact with other wish organizations? Like if a kid has a wish with Hope for Kids, let's say, do you
Yeah, so technically that's one of the exclusions is that if they've gotten another wish from another wish granting organization, so something like this, and because Make-A-Wish is not the only one out there, so that is an exclusion. So if they've gotten something like that, if it's a major wish organization,
declare?
they'd have to declare. Yeah, they have to be honest about that. Yes, I don't know if they're necessarily going and searching that out, but it is one wish.
I've asked, and I have had parents be pretty forthcoming, but I've also had parents that don't want to tell me that they had a wish granted in Washington or another state. And so that is, sometimes we just need to ask specifically. I've also had families that qualified under one diagnosis and now they have another diagnosis. And they're like, well, we had a wish, but it was for the last diagnosis. Does it count for the new one? And that's no, it is still a one-time wish.
There's like big wishes and little wishes. Yeah.
It really does. It depends on, but it's a one wish. So if they make their wish the little wish, I say dream bigger for that one wish. So sometimes they do a wish boost.
Right.
That might be, so say they're not medically ready for that big wish, they will to get continued like that hope intervention, they will say, okay, we're going to do a subset of that wish. So you get a little bit of like a wish experience. That's tiny, but it's still the target is that big a wish.
Yeah, that anticipation part of it can be really good. So, because some of these wishes might take 2 years to actually kind of finalize. So maybe it's 6 months, and at 9 months, until they're getting something, a box shows up, a thing shows up where they get to go on a small thing. But that can kind of be wrapped up in that wish.
Yeah.
Yes.
If we have kiddos that are close to 18, should we be like fast tracking them or?
Yeah, so that's an excellent question, Michelle. So they have to be 18 at the time of referral, because we've done that a little bit. So in looking at this dashboard, Chris and I were looking at this list of 44 something like that patients, for example, with Dravet syndrome, which again, that's a large number. How are we going to prioritize that if I tell somebody lots? So I was doing it reverse by age. We found one, for example, that was turning 18 this month, and we got the referral in before the birthday. And so we put it in sort of as a rush to be at least approved to go through the process.
Okay.
But then they came back and they said, is it a rush because they're at risk for dying? No. I just want to make sure they get in. They're like, okay, now they have the normal time to figure out their wish. So yeah, at the referral.
I have a question on the opposite end of that. Like if you have a child who's very young and might pass away before they're 2.5.
So there will be, you can still refer them. Like if you think this child is not going to make it, they just based on disease trajectory or expectations, they will consider it, and it's reviewed by the National Advisory Council. So that will be reviewed. And I have had a couple of cases where the child was fairly young, and they still did something for them. The criteria is really ultimately to capture those kids within the age range of childhood. And so the wish does not need to be completed by the age of 18. They just need to be referred by the 18. So that's some of the metrics that we've built into the dashboard, is that we've been able to filter that. So we can say, okay, these are all the kids in yellow or 17. They don't even show up on the dashboard until they're 2.5. So those cases would be pretty rare because you would be just thinking about them. But for the dashboard's sake, we've built in a ton of filters, and we can filter it by division and by disease, and you can search by CD10 code.
You search by provider too. I think one of the patients that are mine that fit the criteria that have these things. It's kind of amazing.
And then we're also building in reciprocity from Make-A-Wish as well. So we're going to be creating an interval where they're giving us the kids that from Phoenix Children's who have had their wish completed. And that will be then reported in the dashboard too. So then we're not having those same conversations twice, even though that is a fun conversation to have. Of, you know, if you're talking to a family, they do want to gush about it. It is a really good opportunity of creating that just patient family rapport with families of like, tell me everything you did. And they do, they light up. So it's a fun means to communicate, which I like that it's now going to be a place in the whip note. Because like you said, previously we had no idea of who has had a wish and wish experience or not.
Are there any questions on the line, Christina? Are we okay? Okay. No problem.
Hi, so wonderful. This is the stuff that I think really separates things we get to do for a living. What about traumatic brain and spine injury? That made its
It's
way.
a good question. It has been sort of traditionally not in the Make-A-Wish America category, partly because the thing that happens is horrifying, but then it often, after that point, may not necessarily be life-ending, right? At the time it is, and it's an acute illness that's really significant. A lot of those kids will meet criteria based on certain things. So they meet criteria because they have such a severe cervical cord injury that they are tracheostomy ventilator dependent forever. Those patients are eligible. So, but if they had a one-time thing, it's a little bit different. So that's the only part on that. Yes. You have a question here? So Teresa Johnson was asking about, is there a way to mark the patient has had a wish with the new dashboard maybe within the last year? And that's kind of what we're trying to make sure we do. So the dashboard is not something that people have to necessarily get into, but would send us to get that into it. But in that clip note, we're going to try to have that in there so you could actually search for it. You can see a progress note or a thing in there that says, yes, they had it, yes, they did it, and then it'll be kind of a completed note.
And that's actually something that would be really helpful. So if you do talk to your patients and they've had a wish before, you just type in Make-A-Wish referral in the document type, and then you can say they're currently not eligible, and there's a button that has had wish, and that will again talk to the dashboard. So that will build some reciprocity in the communication among us team members.
So it's a very fast note. You open it, you say, yes, they're not eligible because they had one, boom, done, close.
They can still self-refer, right? Like,
Yes.
They can still self-refer. The self-referrals can happen, right? But I think self-referrals often families don't know what's eligible, so they would have to come back to one of the physicians. But yes, patients.
like for me to make my life easier.
Yes.
I always figure, okay, they are eligible. I tell them to self-refer, and then
Yes.
I find the people.
Yeah, no, I agree completely on that. I think that if you say this patient is probably eligible, you can self-refer, they can go online, a parent can self-refer. And then they're going to say, who's your doctor? They're going to come back to you for the diagnosis verification. And that's wonderful. It does get a little bit to equity because you're separating out for the patient, the families are going to do it. And so sometimes there are families who don't have the ability to get on. They don't have the bandwidth to do it, that time of it. So there are some that you're going to capture wonderfully that way. This way we might get a couple more. So thank you for what you do.
And we also have families that self-refer and they're not eligible. And that is, then the burden is on Make-A-Wish to have those kind of uncomfortable conversations about, well, you don't really meet criteria. And so we're trying to
And it's hard because you want everybody.
I want to be like Oprah.
Everybody, yeah, you get a wish, you get a wish, you get a wish, yeah.
But ultimately it does help if we understand the criteria is coming from us, because then we can have a higher assurance that kids are truly eligible, and it's easier on our wish families and our wish friends that are working on the other side of this for their referral eligibility.
And what a really great thing for PCH to be like part of that, and to have like, you know, that's good for us too, you know, to have helped the family get their wish.
Right. And I think that, I mean, just for me personally, I have had kids who, like, I didn't know my patients got a wish. And so maybe having some of the wish reveals through our systems, and a lot of the kids who are here on campus all the time, you know, maybe letting them be here a little bit, and some of their docs or their providers or their nurses can be there. It's kind of exciting.
That's my unicorn dream soon is to create, you know, this sense of like we are a partnership, right? Because there's a lot of medical trauma that happens in this building, and if we can flip that story.
And they have one really good thing that happens to them in this
and,
place.
And then it's also their nurses, their child life specialists, their social workers, their physicians, their APPs, everybody's involved. Really gets to kind of set the tone for a new experience here at Phoenix Children's. So I think that's really exciting.
Thank you all for coming. Come get some flyers if you need flyers.
Yeah, so we've got eligibility criteria
Squishy
around the
stars,
table,
squishy stars.
the safe to fly information, some chapsticks, some fun stuff.
Very
Yeah,
much.
thank you.